Look at this figure. No need to dig more. There are three types of ganglion in the cervical part of the sympathetic trunk. The superior cervical ganglion, only you will see C1 to C4. Only read this one. Formed by C1 to C4, more than enough. The middle cervical ganglion, C5, C6, and the inferior cervical ganglion only by C7. Clear? Clear? Okay. Sometimes inferior cervical ganglion C7 fuses with T1 and it makes a fusion here. You see a bulging. This ganglion is called stellate ganglion. কি বললাম?
C7T1 এর সাথে sometimes fused হয়ে যায়। Fused একটা ganglion create করে যেটা নাম হচ্ছে stellate ganglion.
Clear? তার মানে superior cervical ganglion is formed by C5 to C6. True, false?
False.
False.
The inferior cervical ganglion is formed by C71. True or false?
False.
False.
Sure?
Sure, bhai.
Sure.
Sure.
The stellate ganglion is formed by fusion of C7T1T2. True or false?
False.
False.
Stellate ganglion is formed by C7T1. True or false?
True.
True. Clear?
True.
So C7T1, if it fuses, it causes stellate ganglion. If there is no fusion, we will never tell it stellate ganglion. Clear? Okay. You see here. You see here. Sometimes in emergency medicine practice, we give block to the stellate ganglion by ultrasonography. External and internal carotid bifurcates at the level of C3, C4.
3 and C4.
That means C3 and C4 cervical level, external and internal carotid bifurcates. So actually, it corresponds with the cricoid level. Okay. So আমরা যেটা করি, first we palpate the internal carotid and just medial to the internal carotid ultrasonographic direction, we insert the needle. Okay. And we block the stellate ganglion. Can anyone tell me what's the indications of stellate ganglion block?
Endarterectomy, severe neck.
Why you need endarterectomy?
Carotid thrombus হলে
Yes.
In case of TIA, we do it.
In case of TIA, আমরা যেটা TIA তে আমরা কি করি? Carotid Doppler দিই, তাই না? We perform carotid Doppler. Why we perform carotid Doppler? To see whether there is an atheromatous plug and the blockage of key carotid artery. Okay. So sometimes end artery to be needed due to carotid thrombus or due to embolectomy. We need to block this portion, stellate ganglion. Say for example, severe neck pain, back pain, palliative treatment like metastatic malignancy or stellate ganglion ablation. So we block stellate ganglion. Here, so these are more than enough for your MRCEM or MRCEM primary. Do you have any question?
I have one question. Inferior cervical ganglion formed only by cervical 7.
Usually.
Okay.
Usually. Sometimes C8 may come. No need. Just keep it in your mind.
Cervical 7.
Cervical 7.
Thank
Don't
you,
make complex. Okay.
Thank you.
Okay. Okay, fine.
ভাই একটা কোশ্চেন ছিল ছোট ভাই
বলেন।
ওই যে মাসকুলোকিউরিনিয়াস নার্ভের রুট ভ্যালুটা কি C5-6 নাকি C5 to C7 একটু
C5 থেকে C7 আমি পরে বলবো। আমি যখন মাসকুলার
ঠিক
পড়াবো
আছে।
তখন আমি ডিটেইলস আপনাকে বলবো। যেহেতু
আচ্ছা,
C5 এবং
ঠিক আছে।
C6 আসতেছে, C5 এবং C6 আসতেছে, এই কারণে আমি বলিতেছি যে in case of upper coordination or upper truncation, muscular cutaneous would be involved. What's
ঠিক
my
আছে।
point? Okay, fine. So we have discussed Horner syndrome details. Can anyone tell me what are the other causes of Horner syndrome. What are the other causes of Horner syndrome?
Spinal cord lesion,
Spinal cord
aortic-
lesion,
Aortic dissection.
root
important cause.
compression,
Venkos tumor,
Venkos tumor, brachial plexus
base of the
involvement,
neck
blunt
trauma.
trauma, base of the neck,
base of the neck, fine. Blunt trauma
Civil
কারণ
line.
হতে পারে। Okay,
Iatrogenic cause.
iatrogenic
penetrating
causes,
injury,
iatrogenic.
stabbing.
So central cause and peripheral cause. So central cause, that means spinal cord causes, especially there may be sometimes saccular dilatation in the spinal cord. Saccular dilatation means this one is spinal cord. Sometimes this is saccular dilatation, which is called syringomyelia, syringobulbia. So no need to dig it more. Just keep it in your mind. There may be saccular dilatation of the spinal cord, which is called syringomyelia, even syringobulbia. Okay. There may be cause of brachial plexus trauma, Pancourt's tumor, especially in the lung apex, carotid artery dissection. Say, for example, it's a 47 years old male who is hypertensive and smoker came to department with sudden severe tearing chest pain. Keep it in your mind. In any question, tearing chest pain, it may be associated with dissection. Okay. So this patient came to you with unilateral ptosis, meiosis, anhidrosis. While measuring the blood pressure, you find that this guy's pressure is 180 by 110. And he has a history of TIA. Okay. So history কি দিছিল আপনাকে? Severe tearing chest pain এর কথা বলছিল। এখন সে আপনার কাছে Horner's নিয়ে আসছে, তাই না? He present with you with Horner syndrome and the blood pressure is 110 by 180 by 110 or hypertensive patient. So suspect that there may be a potential cause of what?
Yeah.
Aortic dissection.
Aortic dissection. Especially যেখান থেকে carotid বের হচ্ছে, carotid dissection হয়ে গেছে। Yeah. So সবসময় clinical orientation বা clinical combinationটা খেয়াল রাখবেন। Always keep it in your mind. Correlate with clinically. Correlate clinically. Okay. Other causes, iatrogenic, there may be central venous catheter insertion, brachial plexus block, penetrating injury, stab injury. So there are lots of causes. Can anyone tell me Pancourt's tumor আর কি করতে পারে?
Hoarseness of voice.
Pancourt's tumor is a tumor in the apex of the lung. It can cause number one, hoarseness of voice.
Hoarseness of voice.
So what's the basic difference between hoarseness and stridor?
Hoarseness yeah.
This is a partial.
Partial আর
complete
হচ্ছে
lesion.
স্টেডারটা হচ্ছে কমপ্লিট
Complete
hoarseness
lesion.
হবে।
Hey, পড়াশোনা করো না কেন? This one is hoarseness.
It's a hoarseness.
This one is stridor.
Okay.
Stridor means complete obstruction.
Complete.
Hoarseness means partial obstruction.
Partial.
And what are the other causes of stridor?
Abscess.
Laryngeal edema.
Retropharyngeal
Hey.
abscess.
Hey, group,
Regular venous
group.
pressure is
তারপরে
একজন বলেন, একজন। Dr. Saidul বলেন, what are the other causes of stridor? Most common cause in case of pediatric child. আপনার কাছে আসলো, he has high grade fever. He is in tripod position and drooling of saliva. Stridor. What's the diagnosis? বুঝেন নাই? A 4 years old boy came to you. He has a history of high grade fever. Now he is sitting in tripod position. That means bending forward, and there is salivation. There is stridor. What's the diagnosis? Epiglottitis.
upper respiratory
Hey.
obstruction.
Epiglottitis. Okay. What are the other causes of stridor? Retropharyngeal abscess, parapharyngeal abscess, anaphylaxis, acute angioedema, foreign body, diphtheria. Lots of causes. Okay. So keep it in your mind that stridor is a medical emergency. Here, it's an emergency. এবং আপনাকে যেটা করতে হবে, you should keep it in your mind that this is a threatened airway. You may need mechanical ventilation at any time. That means you should intubate the patient at any time. Clear? Clear.
Clear,
So
clear.
stridor is a medical emergency. Okay. So Pankos tumor can cause recurrent laryngeal palsy. Recurrent laryngeal palsy কাকে supply দেয়? Supplying muscle.
All the intrinsic muscle
All the
except
intrinsic muscle
precothyroid.
of larynx except precothyroid.
দেখে দেয়
External laryngeal nerve.
External
external
laryngeal.
laryngeal. Okay. So Pankos tumor can cause sympathetic ganglion blockage, which may cause Horner's syndrome. That means ptosis, meiosis, anhidrosis, isn't it? Okay. It can causes supraventricular obstruction. So in case of supraventricular obstruction, what you will find?
Ocular venous pressure is
Face redness হয়ে
JVB raised
যাবে।
থাকবে,
হ্যাঁ,
straight out
JVP
থাকবে।
raised থাকবে. That means
flashing of face.
facial swelling থাকবে।
you will get engorged neck veins, flashing of plethoric face. If in the chest there will be distended veins, isn't it? Patient will be leaning forward. After you lying flat করবেন patient, when you make the patient flat, breathlessness will increase. There may be stridor also. Okay, so what's the treatment here? Oxygen
Steroid
therapy,
দিতে হবে।
steroids, and sometimes this patient may need interventional radio frequency ablation. Okay, fine. Okay, fine. I don't want to dig it more. So Pankos tumor can cause phrenic nerve palsy. Okay. Bilateral or unilateral phrenic nerve palsy.
Unilateral.
Unilateral phrenic palsy. So how will you diagnose unilateral phrenic palsy?
By doing a chest X-ray or by looking at respiration.
Respiration কি পাবেন? What you will get in the respiration?
এক সাইডে চেস্ট মুভ করবে না বা উঠবে না।
Excellent.
side-
That means chest will be movement will be abolished in the affected side. আর air entry stethoscope বসালে কি পাবেন? Air entry পাবেন না পাবেন না?
এফেক্টেড সাইডে পাবো না ভাই, কারণ লাংটা এক্সপ্যান্ড।
Yes, lung expand করতেছে না, so there will be no air entry. And if you perform chest X-ray, there will be elevation of the hemidiaphragm.
Thank you.
So is there any question? Is there any question? No question. Good.